Good morning, or I should say, I'm sorry, good afternoon.
Hi, Emery.
Chairperson Frost and members of the board. It's nice to actually come back, even if we have to wear a mask. I think it's actually quite fitting, all the items that we've heard already this morning, to kind of round this topic out with what I think everybody should understand about what's happening, not just across this country, but across the state and across this county in terms of what I would call a fentanyl epidemic. And I just wanted to kind of give you a little bit of background on why did we feel the need to come present this. A few months ago, some of my colleagues, elected DAs from other counties, started to raise this issue and asking me and others in the same profession, are you seeing this problem? And so I felt that it was important that we understand what is the problem here in our county and how can we try to address it, not just from the prosecution point of view, but from a prevention point of view. I don't think there's any question, as many of you probably are very aware, that we have a national problem when it comes to this. This is just a headline from a national story about this, the fact that fentanyl can kill millions and millions of people. And just recently there was an article that came out in a San Francisco paper, and the title of that article was, "Fentanyl has changed the whole landscape. San Francisco faces the worst drug epidemic ever." And with that article, the head of their emergency room, the chief doctor, essentially said in that article, it's really remarkable because it runs the entire spectrum. This affects all walks of life, all folks. It's hard to overstate how impactful it can be to anyone. It doesn't seem to care about race or background or gender or anything. And I think that's something that's very true here in Sacramento. In that same article, it talked about a recent law enforcement bust that would be enough to wipe out the entire population of San Francisco 4 times over. So when we started to try to figure out in our county, we wanted to look at, our own number of deaths. We wanted to look at our cases that we were prosecuting for people that were possessing fentanyl, particularly fentanyl for sale. And when we started to kind of just look at it, I tasked our Chief Deputy, Rod Norgard, find out what we're seeing with our deaths. And it was quite really, to me, shocking. Before we found out the number of deaths, our crime lab, as you all know, we're very fortunate in this county to have our own crime lab. And those numbers I'll give you in a minute, but that was equally shocking to me, at least. So what we saw with our number of fentanyl deaths, we looked at, and this we basically worked with our coroner's office. Kim Jin has been fantastic on this project, and we looked at how many folks are dying of fentanyl deaths compared to just to homicides in our county. So we looked at January 2020 to the end of 2020, and we saw that we had 88 fentanyl deaths, which is a large number, and compared to our homicide rate last year was 119. And then this year, just in the first several months up till the July 21st when we were collecting the data, we have seen now 52 fentanyl deaths compared to 62. That number, 62 homicides, that number fluctuates and it's almost even. The total number in this time period is 140. We still have actually a number of cases outstanding from the coroner's office because we're waiting for toxicology. So that number was really, in my opinion, a very staggering number. A couple weeks ago, myself and our chief deputy met with several families that have lost loved ones to fentanyl overdoses. And having been in this business for a long time, these are very, very hard conversations to have. Honestly, it was a lot of tears and devastation for lost loved ones. And I think what we came away from was the magnitude of the problem and the critical nature of us trying to flood our community with prevention, because we will not prosecute our way out of this problem ever. We just simply will not. And we don't have the tools to do that as well. So what does it look like? What are those demographics? Because I know that some folks want to know what are we seeing. Obviously in San Francisco, we know that the demographics are across all spectrums, and I would say the same is true for this county as well. I think what's interesting is, in this graph, is a little bit hard to see, but what you can see is that 2020, we see a lot of these deaths under the age of, I would say, 30 and below. And then even just this year, we're seeing that even a little bit different. We're still seeing more in that teenage range. And this is all particularly concerning, particularly me as a parent of a couple teenagers. So these numbers are concerning, but what was probably even more concerning to me, because we have that crime lab, is that our crime lab has told us when they get street drugs into our lab for analysis, they are finding that 92% of oxycodone pills are counterfeit. That is a staggering number. Of those pills, 75% of those fake pills are straight fentanyl. That is, honestly, that's probably the most staggering statistic I've seen of all of it. And what we know from just the science is that really half of one of these pills can kill you. If you look at the image on the right, it shows you it's very, very difficult for anybody to understand the difference between a real pill and a fake pill. So when we then started to kind of look at, okay, what are we doing as first responders? What are we doing to try to track the data? I had a lot of questions in my head, what's happening at the hospitals, what's happening on the streets. And it's not a criticism, it's just that it seems that we're all still catching up on what do we need to do, because while we have 140 deaths, we don't know, I don't believe, and maybe Dr. Kathari or Dr. Quist can tell us, I don't think we're tracking near deaths. And that's really a healthcare system. If I had, the power one day, I would probably ask that when we have child abuse or domestic violence and that presents itself to our healthcare systems, there is a mandatory reporting system that's in place so we can understand the problem and follow through with that. We do not have that with fentanyl overdoses, or as far as I know, any types of near-death overdoses, I should say. I do know that other states and other counties are mapping this data. I was actually surprised to hear that our police department in Folsom has this program. It's called ODMAP. Many states on the East Coast already do this. And that mapping system allows officers to record fentanyl-related incidents. This year in Folsom alone, they've had 13 related overdoses. 7 of those resulted in death. And 6 of those individuals were saved by naloxone, which is Narcan, or what can actually save people from those overdoses. So that's just a mapping system that I think would be a valuable tool that we can consider at some point.
Excuse me, yes. Supervisor Natoli had a question.
Oh, yeah. Sorry.
Yeah, thanks, Anne-Marie. Just so the fentanyl, is it being manufactured here stateside, or is it coming in?
I think if you look at most of the data, a lot of folks would say it's coming from foreign countries, okay. And then it's being pressed into pill formats, although I think I heard this morning from our crime lab that we are starting to see it in a powder format. But it's being pressed into these pills, so people think it's Percocet, or they think it's Adderall, they think it's Xanax, and in fact it's straight fentanyl in many of those cases.
But it's being pressed, the raw drug is coming in, at least before it's made in pill form,
right,
stateside, and then labs here or whatever that are, I don't know if it's cartels or labs or whatever, that are actually putting it in pill form and then sending it out to the streets.
I think it's going to other countries, and then it's being pressed into pill form in other countries. That seems to be the trend,
okay.
Or at least the anecdotal information out there, and then it's coming into our communities at an enormous rate. And this next picture I'm going to show you is a case that's actually pending. It's not really relevant which case, but this is a case that involves a 16-year-old girl who overdosed on fentanyl. Law enforcement got involved, and this is a photograph of the items recovered from the individual that provided those drugs to that teenager. And the most important thing I would say is that in that recovery process, they found 6,000 fake pills that were laced with fentanyl. They also found illegal weapons, ghost guns, which seems to be Not necessarily common, but it is not unique to find those types of things. So the combination of large amounts, I mean, that's 6,000 fake pills. You can kill somebody with a half a pill. So the destruction value of this is enormous.
Can you prosecute?
Excuse me.
I'm sorry, can you prosecute them for murder?
Well, I'm going to get to that.
Okay. Okay.
But I will tell you what we're trying to do in a courtroom. That's probably a very common question from the family members that have lost loved ones.
Supervisor Kennedy had a question.
Sure.
Thank you, District Attorney. You mentioned Narcan. Of the 7 jurisdictions in Sacramento County, how many have adopted use of that?
I don't know the answer to that question. I do think that it would be a valuable conversation for this county and our community to talk about doing Narcan giveaways.
Yeah.
That's how, I mean, my colleague in San Diego was doing it this weekend in combination with public health and AMR, where they're actually giving. It's not a difficult thing. It's not an addictive thing. These guys are far better experts to talk about that, but I do think we should be working with the schools and our community, all our community partners, on those type of giveaways.
So I guess more to our staff here is I'd like for those conversations to take place.
Yeah, I think that would be fantastic. Thank you for raising that.
And also the follow-up reporting, is there a way we can create an ordinance or whatever that would require the follow-up reporting on fentanyl deaths or near
like
deaths?
a local ordinance?
Near deaths. Yeah, is that what you were talking about?
Yes, I think I've had some conversations with folks from UC Davis. Again, the public health probably has the greater relationships, but I do think understanding the problem means us to track the data. It also would help law enforcement. The part of that OD map, the value of that mapping program that officers use is they can see an influx of fentanyl in a particular area, and that will help raise awareness as to the dangers that is being presented at a certain time.
So is that a resource for our public safety, or is that something we need to do here to
I think it's.
require
I don't
it?
think it's. I think it's a resource for public safety and first responders. I know Folsom PD is now doing it with their fire department as well. And I'm going to show you a video that I've talked to some of the chief firefighters in terms of. I think it's just us trying to get these folks on board and making sure that we can map where these things are happening. Okay, so let me just I just broke it down to a couple of things that I think we're trying to address, and hopefully our community and all of our partners are willing to work with us. Obviously, high levels of fentanyl death, high level of fentanyl pills on our streets. Obviously, we would love to see some more data, and then the most important thing, at least from my perspective at this point, is this public outreach part. So Supervisor Natoli asked about, well, what can we do with these people that are pushing these pills? That is what I would call our in the courtroom efforts. And then the second part of this, I think, which is a bigger issue, is what are we going to do in the community? So part of what we're doing in the courtroom, and this is many DA's offices across the state are doing this. The biggest challenge, and we had an honest conversation with many of these families because they want to know, can we prosecute these people for murder? They killed my child. Many of these people pushing these pills may not know that they're pushing fentanyl. Now, there may be drug dealers out there that know, and so what we have to prove certain things in a courtroom. And so what we are doing now is we are doing what's called an advisement. So today in California, if you are convicted of drunk driving, many counties will advise that person when they plead guilty that drinking and driving can kill somebody. And if you choose to do it again and you kill somebody, you can be prosecuted for homicide. So the similar concept is now occurring, at least in our county, on a case-by-case basis. So we have people selling fentanyl. You have 6,000 pills. If that person is convicted of selling fentanyl, we will ask the court to advise them that the same consequence will happen if you choose to sell this again and you kill somebody. So we're doing what we can. But again, when you're talking about one pill, somebody takes one pill, that's much more difficult burden of proof.
Madam Chair?
Oh, excuse me, Supervisor Cerna.
Thank you. So, Emery, to that point, is that for the layperson should that be kind of considered a legitimate, like, first strike then? The advisement?
It's not, it's a notice. It's what we call a notice requirement. So there's an area of law called implied malice under the murder theory that you have to know what you're doing is dangerous to be held accountable. And so providing that notice advisement in a courtroom where a judge tells you, you sold fentanyl, if you do it again and you kill somebody, you can be held accountable under that, what we call implied malice.
Got it. Thank you.
Okay. So
I think that's the hardest part for the families in my district
it
who
is
lost
very
someone.
much the hardest part because, and trust me, it was heartbreaking.
Yeah.
You know, to wake your 17-year-old son up and realize that he's deceased is very, very difficult. I will say this, when we talk about the kind of the community outreach plan, we've had great conversations with the Department of Health Services. We met with them. I think we are very much in the industry of collaborating, and we know that we cannot do this alone, and we need to all work together. They have a great, obviously, the SAC Opioid Coalition that they've been working on for many years, and we've asked to have members of our office join that coalition. So what are we going to try to do in the community? Well, obviously a public awareness campaign. We want to develop some of those partnerships with law enforcement. I'm a huge believer in partnering with our schools. And then what I would also like to do is to partner with our healthcare systems and our healthcare agencies. In terms of what are we doing, I'm going to be bold and just say we've asked some of the ART money. We will do as much as we can for free, whether it's through partnerships with, Clear Channel or whatever. But we will be much, much more effective if we can put some dollars behind this public awareness campaign. We do know that we want to target two different audiences. One is the general population, and then secondly is our parent, guardian, youth messaging. So when we talk about the schools, one of the concerns I had when we first realized the significance of the problem was our kids are back on campus now. They're in person, and there will be drugs, unfortunately, on many of our school campuses. So the concern was, can we try to get a relationship or partnership going with the schools immediately? I'm very fortunate to have a good relationship with Dave Gordon, and so we've already had conversations with them. Very, very supportive. Had conversations with all the districts, and they're very, very engaged, and we're working with their various PIOs to get these PSA materials out to their students, to their administrators, parents and guardians, and any other group that is willing to listen. This is just kind of a blanket of how we think we can try to reach folks. Social media, next door, billboards, public transit, local and TV radio, streaming, print pubs, movie theaters. We've seen them being done in other counties across California where you can try to reach folks. When it comes to some of the, like the digital billboards, we're working with Clear Channel, as I mentioned. Our hope on social media is to actually do some type of targeted messaging, particularly through things like Instagram and Snapchat, which we know is the playground for drug dealers of trying to reach younger people to try to actually push these pills. I'll just give you a couple examples.
Excuse me, Supervisor Desmond had a question.
Thank you, Madam Chair. Anne Marie, thank you so much. This is very distressing. I'm curious, with the pharmaceutical companies whose pills are being counterfeited, what kind of resources are they providing, if any, for some of this public awareness?
We haven't actually asked. Okay. Probably a good point to start asking about it, because it's definitely something that is a significant problem, but very good point.
Okay, thank you.
So the materials that we're going to try to push out through our PSA would be obviously flyers, videos, billboards, posters, banners, print ads. These are just some of the things we did create a website that hopefully we can put all our resources into one. It's called onepillcankillsac.com. That'll be launched later today, which will have a lot of these resources on it. This is kind of what we came up with in terms of two different audiences, the general public and then the parents and guardians, so that they understand. I mean, it's really shocking, particularly when you look at the penny and you compare it to how much you need for actually killing somebody. It's minuscule. So hopefully this is going to be effective. We've got billboards planned that hopefully we can get this out. One of my colleagues in Fresno was on a campaign the other day. They have major billboards going on all over Fresno as well. We would obviously like to join as many partners on this whole campaign as possible. Bus transits. And then I want to show you, I'm just going to show the second one. The first version, which says long version of our crime lab. This is Craig Trebold from our crime lab. And he does about a 3-minute video on the dangers of these pills and how they look really real. And then the second one, which I'd ask if, can you do that for me, Flo? Set it up, the video?
Yeah, they have
The one on the right with, so this is Fire Chief Walt White. I actually called him up just to pick his brain about the problem. And then he gave me his personal story, so he was willing to share that.
Fire Chief Walt White. And as a first responder, I have witnessed firsthand the impacts of overdose. And I've experienced them as my own brother lost his life to an opioid overdose. Addiction can be like a swimming pool to a child on a hot summer day. Very easy to get into, very hard to get out of, and just as deadly if not properly supervised. Never, ever take medications that aren't prescribed to you by a licensed physician. Where are people getting drugs? If they cannot get a prescription, they'll resort to seeking medication from family members, friends, or out on the street. And when you choose to do that, there's no quality assurance in what you're receiving, and one dose could be fatal.
Warning.
Hi.
A single.
So I think the most important thing that I'm hoping we can all walk away with is just this united front against this epidemic. I think the hope and the mission is that we can join together with our nonprofits, our healthcare, our faith-based community, public health, schools, and law enforcement. It's in San Diego County, they're on track of having 700 people die this year from fentanyl. I worry how we are going to be here as a community, but everything we do now, moving forward to prevent this, can only help all of us. So I'd love to answer questions. Again, that website will go up live today.
Thank you, DA Schubert. Supervisor Cerna.
Thank you. Thank you, DA Schubert, for the enlightening and somewhat depressing presentation. But it's obviously information that has to get out, and people need to be aware of the dangers of fentanyl. With regard to kind of the last third of your presentation with regard to public outreach and messaging, I'm just wondering, I'm sure you probably have thought about this, but is there an opportunity for the coroner to play a very prominent role, simply explaining, the fact that a death that results from fentanyl overdose has, all kinds of consequence for the family, for the community. I remember my late father, in response to some gang shootings during his tenure as mayor, organized a trip to the morgue for some youth that were engaged in gang activity, and that seemed to have a pretty strong impact on folks. I'm not certain that is appropriate here, but it just seems to me that there's a real good opportunity for the coroner to be kind of front and center on this as well.
I agree with you. I think the world of Kim Jim, and I think she's been very helpful in gathering all these statistics. So one other program that we have in Sacramento and across the state that is very powerful is called Real DUI in the Classroom, which brings a real DUI case to high schools. And the person that runs that is Chaplain Mindy's daughter, Angela Kellogg. And so we talked last week about trying to seek grant funding for a very similar thing with respect to fentanyl. And many of these families, as heartbroken as they are, want to help. And as we see, many good things come out of tragedies. So I think if we can engage folks as much as we can start to deal with this problem.
Is there a group for the parents of these folks or the family members
There's a nonprofit that was started called Charlie's Story, I think it's called, that many of them have joined, and many of them are now starting to speak out publicly about the significance of this problem.
That's good. Supervisor Natoli.
Yeah, kind of, I guess more of a question for Ann. So certainly having heard the presentation, I think the depth of the seriousness of it, and certainly life's threatened by it. With the ARPA requests, how are we channeling these? I know you said earlier this morning, and I know you did in the briefing yesterday, that you're going to be bringing kind of broad categories. Certainly this falls into health, prevention, intervention, at least in my view it would. So how are we going to kind of get all these encapsulated? Obviously, Anne Marie will be here, making her pitch again, I'm sure, because of, how strongly she feels about it, and those in the law enforcement community and people that she's hearing from directly. So when will we see the opportunity? Because we've had other people inquire about that, and, you're going to bring broad categories, but some of this will be a backdrop to how we might categorize some of those dollars, so.
Yes, so we intend to bring the categories to you in mid-September after the budget hearings, and then it will probably be shortly, well, not completely shortly, but October probably, before we bring any specific projects to you, because we'll have to start reviewing. As you know, we have many applications such as this. We have departmental requests, and we have requests from the community, and we'll be evaluating all of those as it relates to the funding categories that were approved, and comparing them with the Treasury guidance on what's allowable.
So in the event that the guidance wasn't there, that this was allowable, then if we've already passed the budget discussions that we're going to have in a couple of weeks, I guess I'm a little concerned that we have the opportunity, again, there's not a specific request here today for us, but for some of the mediums and the media approach, there are costs associated with doing that, and there's costs associated with not doing it, I guess. So how would we evaluate that if we don't know the guidance is going to say this is something that we could do or not do, and yet, taking this up in the budget context where we have a lot of competing demands and so forth, but obviously Anne Marie could certainly put together, a request if we ask for that, or maybe she's prepared to do that already, but I don't want to miss the opportunity to at least have the discussion around how we might best support this in whatever way, but it's going to include some resources and requests, I'm sure. So
We can certainly make a determination before the budget as to whether or not this is allowable under ARPA funding.
Okay.
I think we can do that fairly
that would be helpful
quickly.
then.
Yes.
Because if the answer is no, then it presents, certainly within the context of the full budget discussion, it presents the opportunity for us to do it there and or to wait until October when we know we're going to have a significant sum of money that we're going to be discussing about appropriating. So
Yes.
Okay. All right. Good. Thank you.
Agreed.
Thanks, Anne Marie.
Thank you. Thank you,